Opportunity to come and speak to you. Um, I was asked to speak about the use of HCG triggering for IUI cycles as opposed to IVF, and this is really a very broad topic. So I'm going to really speak in broad strokes here and give just an overview of this topic in very broad strokes. So our standard of care for the treatment of unexplained infertility is, as I tell my patients, more eggs, more sperm, hope something hits something. It's really a very almost juvenile view of how to treat a disease. Just hope to get more stuff where they need to be and hope something takes. And that's sort of our approach to the treatment of unexplained infertility. And in our practice, 50 to 60% of our patients are unexplained infertility because the majority of patients that are easy to take care of, they get taken care of by their primary care doctors before they actually get to my center. So we have a huge amount of unexplained infertility that's really very frustrating to treat because of how unfocused our approach is in their treatment. So we do this concept of more eggs and more sperm by using ovulation induction and getting them to make more eggs. And then in our practice, we tend to ultrasound monitor them to make sure that our treatment is effective. And then we give them HCG to release their eggs and do an IUI at the time we think is going to be the most likely to produce a conception. And we take that approach with the expectation that it's actually going to help them get pregnant. And so really the idea of this talk is to discuss whether or not that actually works. So we're going to review the role of HCG during ovulation induction, talk a little bit about the timing of HCG in the IUI, and whether or not the HCG itself is even appropriate.